Good evening. Unions are outraged by recommendations urging jobs and hospital beds be slashed in a bid to resuscitate the health system's hemorrhaging budget. The government-commissioned report suggests cutting more than 300 full-time employees and in excess of 100 beds.
Angry union leaders leave their meeting with the government grasping the bad news.
We're disappointed. The recommendations, if adopted, would mean at least 308 full-time equivalent jobs to go out of the health service.
On top of the hundreds of axed workers, beds could also be slashed. The nurses' union says it's outrageous.
Patient safety would be put at risk if they were to implement the recommendations contained in these reports.
Apart from rejecting calls to close the Noarlunga Emergency Department at night, the government says no other decisions have been made, but acknowledges urgent actions required to revive an ailing health budget.
We are not going to be able to continue to afford to provide the high quality of care unless we can make some sensible economies in our system.
We have to do something about reining in costs, and health can't be exempt from those pressures.
60% of the public health budget goes into our 7 metropolitan hospitals, which were reviewed in the independent reports. If all of the measures are adopted, the government would save $83 million a year by 2015. The opposition says the need for such cuts is an admission of the government's financial mismanagement.
They've hired people, they've run up the bills, they're now trying to get things back into balance.
The reports will be publicly available for 6 weeks of debate. Kate Dorsey, 9 News.